Hey everyone, welcome to Digital Wonder. Depression is one of the most common illnesses diagnosed in Western society, with 20% of people going through one major depressive episode at least once in their life. Currently, 264 million people are suffering from depression according to the World Health Organization. We all know some of the symptoms of depression, and just for a recap, some common symptoms include low mood, loss of interest in activities a person used to love, and feelings of hopelessness and worthlessness. Depending on how much you've read about depression before, that might be all you know. But did you know that depression can cause a myriad of symptoms, some of which are unusual and we would rarely think or due to a mental illness? Listen on to learn more about the uncommon symptoms of depression and how these might present. Make sure to watch until number 10, as very few people know about this uncommon symptom of depression. Number 1. Weight fluctuations. It is very common for depression to affect appetite, as the neurotransmitters involved in regulating hunger are affected. More commonly depressed individuals will experience a loss of appetite and will usually lose weight without even trying. Some people, however, will rely on food to try to improve their mood and will eat more and gain weight as part of their illness. Weight gain is sometimes part of what is referred to as atypical depression, a triad of symptoms that includes weight gain, a normal affect, which means the person does not appear sad externally, and a heaviness in the limbs. Sometimes weight fluctuations can trigger depression, as carrying more fat is linked to increased inflammation in the body, and this has been linked to an increased risk of depression. So this can be a little bit of a chicken and egg conundrum. Number 2. Sleep disturbance. In medical textbooks, early morning awakening is linked to depression. This means waking up very early, a couple of hours before one's alarm, and struggling to get back to sleep. More recently, however, we know that other types of sleep problems can be part of a depressive illness. This includes waking up in the night and not being able to fall asleep. Sleep problems remain a telltale sign for clinicians when they diagnose depression and may link to problems with concentration and memory and fatigue. Number 3. Concentration and memory problems. Depression affects many of the brain's functions. A change in neurotransmitter concentrations, especially on the noradrenaline serotonin dopamine axis, can affect wakefulness and concentration. Many individuals with depression can't focus their attention, and in more serious instances, can lose concentration while watching TV, in the middle of a conversation, or reading a book. This can cause issues with work and with relationships for people, as they can seem ditzy or disinterested, while in reality, they are trying their best but simply can't stay focused. Number 4. Fatigue. Fatigue is an all-encompassing feeling of exhaustion. It is difficult to explain to others who may have never felt it, but basically, a person might not feel physically or mentally able to complete even simple activities of daily living. A person might lie in bed all day, not because they want to or are being lazy, but because they just don't have the get up and go to start doing things. This is again governed by neurotransmitters and inflammation and can be resolved with treatment. Number 5. Pain. Heaviness or pain in the limbs, back, and muscles without any other physical cause can occasionally be attributed to depression. These aches can be severe and are very real for the person experiencing them. It's not fully understood how depression is linked to physical pain. Research has shown that the brain areas for physical pain are triggered with the same intensity from experiencing psychological pain. So the body and mind are linked. A book that explores this topic in more detail is The Body Keeps the Score. It discusses the author's experience of treating survivors of trauma with a number of issues. By caring for the body, it can help care for the mind. Number 6. Irritability and anger. Although we often associate lethargy, malaise, and low mood with depression, some individuals' personalities and genetics respond differently to the same neurological trigger. Instead, they may become irritable, snappy, and short with loved ones for the smallest of reasons. This will not have been typical for them before they became ill and may be noticed by close friends and family. This can cause issues with work and relationships and increase a person's sense of isolation, as other people may start distancing themselves from them. Losing friends or a partner may further another symptom of depression, which is low self-esteem and low tolerance for rejection. Number 7. Low self-esteem. A person's sense of self and self-value can be affected by depression. This is likely a combination of direct mechanisms or actual changes in neurotransmitters in the brain and indirect mechanisms such as symptoms of depression leading them to become more isolated, to perform worse at work or school, and to blame themselves for things that aren't their fault. This is closely linked to increased feelings of guilt, which may not make sense to other people as the person appears to take on responsibility for things they cannot control and would typically not be expected to control. When a person's self-esteem is damaged and they think very little of themselves, they may also see this reflected in unrelated events. For example, they may take even the smallest rejection very badly and see constructive feedback from a friend or a colleague as evidence of their own inadequacy. Number 8. Loss of libido. Another strain on romantic relationships with a person who suffers from depression could be that they lose interest in sex. The reasons for this can be complex. This can lead to unhappiness and arguments in relationships, as the other person may see the disinterest as a personal rejection and feel that their partner no longer wants to share intimacy with them. They may not understand what is going on, or that the person is not engaging because of an illness, which then can lead the depressed individual to have more guilt and even lower self-esteem. Number 9. Substance misuse. Depression is a difficult illness to cope with. It isolates a person from their loved ones and, as we've seen, can cause a change in a person's appearance, self-esteem, and behavior. People try to make themselves feel better in any way they can. And that can mean misusing certain substances such as tobacco, alcohol, or other drugs. The link between depression and substance misuse is well documented, and unfortunately, substance misuse can make depressive symptoms worse. So now the individual has two problems that are perpetuating one another. Alcohol in particular can significantly exacerbate the symptoms of depression. Getting help for both problems becomes very important for breaking the cycle and healing. Number 10. Psychosis. Depression with a psychotic element is a severe illness that requires urgent medical attention. If a person has psychotic features with their depression, they should see their healthcare provider immediately. Psychosis is a collective term for a number of symptoms including visual and auditory hallucinations and delusions, and paranoid beliefs. In depression, any number of psychotic features can occur. However, nihilist delusions are relatively more common than others. An example of a nihilistic delusion is the belief that one's body is rotting from the inside, or that one has an incurable disease no one else can see that is slowly killing the person's body. Psychotic symptoms in depression can be obvious or subtle, and only a qualified healthcare professional can help give an accurate diagnosis, as there are a vast number of causes of psychosis. All these issues can make a person feel very isolated and helpless, and in some instances lead to self-harm and suicidal behavior. If you identify with some of these symptoms or think a loved one might be depressed, we encourage you to seek professional help or to speak to your loved one, as offering an empathic ear and encouraging them to seek help can be the start of breaking the cycle. Subscribe and turn on notifications so you don't miss more videos on depression and much more. Check out this playlist of our top 10 videos of psychology tips, and I'll see you in the next video. Take care!